Welcome to Resuscitation VR for First Aid. In this tutorial we'll familiarize you with how to use the controls. Just so you know, you can leave and go back to the main menu at any time by selecting the door. You should notice a dot in the middle of the screen. In simulations, you will select things by looking at them and pulling the index finger trigger to select them. Let's start by exploring what interactive objects look like. Look at the medkit on the table in front of you. Make sure that the medkit is aligned with the dot. Great, you'll notice that the medkit is highlighted and a name tag is shown. Now let's select the medkit. On either of your VR controllers, pull the trigger that your index finger is resting on. Excellent. You'll now see that a radial menu has appeared, which shows you what options are available. Try selecting any of the options here by looking at them and pulling the index finger trigger. Great, you've got the hang of selecting options. In Resuscitation VR for First Aid, you may be required to perform CPR on a patient. Let's go through the steps on how to do this now. You'll want to start by getting yourself in position. Make sure you are next to the patient's chest. Please remember that all objects you see are virtual, and you should never try to lean or put weight on them. Your VR controllers are represented by virtual hands in these simulations. You'll see that when you move your hands around, the virtual hands follow. Try moving your hands to the upper chest of the virtual patient. You'll see that when they get close to the heart, they will snap into a pose for chest compressions. Get both hands ready. Good, now press the A or X button on your preferred controller. That's the lower of the two buttons next to the joystick where your thumb is resting. Nice, see how when you press this button it performs a chest compression. Keep pressing this button to start a rhythm of compressions. You should try to press it once every half a second to get the ideal rate. You can see your chest compression rate in the floating text in front of you. Perform 30 compressions and we'll move to the next step. Once you've delivered 30 compressions, you should ideally deliver 2 breaths to the patient. To do this, you will need to lean over and put your mouth next to the patient's mouth. Remember not to try and lean on virtual objects. See that once you are in the right position, you will open the patient's mouth. Press the A or X button to deliver a breath, and press it again to deliver the second breath. These are the same buttons you used for chest compression. Perfect, you now know how to use the controls to make decisions and perform CPR during an emergency. This concludes the tutorial. You can stay here as long as you need to practice the controls, and then select the door to return to the main menu when you're ready.
This is Lee, 63-year-old male. He was found struggling to breathe and panicking. He doesn't seem to be in a clear state of mind, but we've done our best to calm him. We'll leave him in your care now.
What should we do first? Okay, Lee, just lay down for us here, please.
There's swelling with his tongue and throat. I'll keep an eye on it.
All right, I've got him connected for vitals. What's our next action?
I understand.
Okay, giving fluids. Okay, giving adrenaline. I'm not seeing much improvement from that dose. Okay, the Resus team are on their way. Okay, giving adrenaline. I'm not seeing much improvement from that dose. Alright, let's continue the refractory algorithm until the Resus team arrives.
Hi, Catherine. We're here to help. Try to relax. Let's take a look at you. I need you to take lead on this. What's our next action? Got it. I'll contact the Resus team. Hi, dispatch. We have a possible emergency here, requesting a team to be sent. Female patient, in her 70s, struggling to breathe. She seems to have swelling around her throat. We're at 502 Curtis Avenue. Thank you. We'll keep you updated if the situation changes. Okay, the team are on their way. Okay, giving adrenaline. Okay, Catherine, just lay down for us here, please. You're looking a bit better now, Catherine. We'll stay with you for a while to make sure you're all right.
Hi Lee, your door was open. Are you okay? Can you hear me, Lee? Let me check him. You need to start CPR. He isn't breathing, no pulse. Airway is clear. What do we do next?
Hi dispatch, we have an emergency here, requesting a team to be sent urgently. Male patient, in his 60s, no pulse and he's not breathing. We're at 502 Curtis Avenue. Thank you. We'll keep you updated if the situation changes.
Right. I'll go get the AED. I've got it. I'll put it over here. Stay calm and follow these instructions. Make sure emergency services are called now. Begin by exposing patient's bare chest. Remove or cut clothing if needed. When the patient's chest is bare, remove the square package from the AED. Tear open the package and remove the pads. Remove the pads from the plastic and firmly place on the patient's bare chest, exactly as shown on the pads. Alright, I'll get the pads in place. Do not touch the patient, analyzing heart rhythm. Shock advised. Push the flashing red button to deliver shock. I'm clear. Shock delivered. He's breathing. Hi Lee, we're here to help. Stay calm. We're going to get you to the hospital, okay?
Jake, why are you in here? Can you hear me, Jake? Oh no, he isn't breathing. No pulse. What do we do? Right, yes. I'll call 999. Hello. Yes, I need an ambulance. We have a child who doesn't seem to be breathing. We're at Hawksmead Primary School. An AED? They say there's an AED we'll need to get, in case the ambulance can't get here in time. Yes, we understand. Okay, thank you. Yes, we'll call back if anything changes. Bye. Right. I'll go find it and bring it here. I've got it. I'll put it over here. You were trained with one of these, right?
Stay calm and follow these instructions. Make sure emergency services are called now. Begin by exposing patient's bare chest. Remove or cut clothing if needed. When the patient's chest is bare, remove the square package from the AED. Tear open the package and remove the pads. Remove the pads from the plastic and firmly place on the patient's bare chest, exactly as shown on the pads.
All right, I'll get the pads in place. There's instructions on them.
Do not touch the patient, analyzing heart rhythm. Shock advised. Push the flashing red button to deliver shock.
I'm clear.
Shock delivered. It is now safe to touch the patient.
He's breathing. Hi, Jake. Stay calm. You've been unconscious. We're going to get you to the hospital, okay? They're here. I can hear the ambulance. You stay with him and I'll go get them.